Veneto-STOP is being presented here at ASH as a trials in progress. Venetoclax, which is a BCL2 inhibitor, is approved for the treatment of CLL. The indications for treatment in CLL have broadened with each sort of advancement in its approval. So initially it was indefinite therapy, and then based on the Murano study got reduced to 2 years of therapy in the relapse setting, and then most recently, based on the CLL-14 study, it's 1 year of treatment. The truth is that we don't really know exactly how long you need to treat a patient with venetoclax treatment. We do know that if you're able to achieve undetectable MRD status or minimal residual disease status with venetoclax, those patients have a better progression-free survival than those who have not. We also know that there are patients who are able to achieve undetectable MRD and are able to come off therapy for a period of time and be monitored off treatment for several months and even in some cases years. And we also know that if you do stop treatment with the evidence of minimal residual disease, so with disease present, there is a higher likelihood that your disease is going to progress sooner than someone who has undetectable MRD. So what that all really just tells us is that probably the treatment of patients with CLL with venetoclax should be individualized based on the patient and their response to therapy. So the Veneto-STOP study is looking at patients who are on venetoclax therapy who are able to achieve undetectable MRD status. And for those patients, that's where the trial begins, and that they discontinue therapy at that time. As long as they've been on treatment for at least 6 months, they can have received venetoclax monotherapy or venetoclax in addition to an anti-CD20 monoclonal antibody combination. But as long as you've been on treatment for at least 6 months and have achieved undetectable MRD, then we're allowing patients to discontinue therapy as part of the trial. And then what the trial really does is we track patients. We check their MRD status every 3 months for up to 3 years. And our assessment for the assay we're using for assessing MRD is the NGS panel. What we're looking at is to see how many patients can remain off therapy for a period of time, up to hopefully at least 12 cycles, if not longer. We're looking to see how many patients actually need treatment again. We're encouraging patients to go back on their venetoclax-based therapy so we can get a better idea of how well they respond to the same agent again. In theory, we think it probably will work, but we'd like to get some more data around that because there's just minimal information at this time. And when they do restart therapy, we're looking at how effective the drug is, both in terms of response rates, but also the ability to achieve MRD negativity again.